Is there any right age for females to conceive?
Till 30, it's a green zone. 30 to 35, you should really start working on it. And after 35,
What are the initial signs of you knowing that you are having PCOS or PCOD?
wheresoever the skin folds are there, there is this blackening of the skin there. Yes, of course, the facial hair, chin hair, weight gain.
We can say if not taken care of, it can affect her.
Yes, of course, in conception.
Oh, I didn't know this.
It's not a disease. It's just a disorder.
How long does it take for someone to get rid of it? Endometriosis?
Near about 40 to 60% of the females nowadays, they are undergoing this thing.
Why has the fertility rate suddenly dropped in India? And I want you to be very brutally honest.
Infertility never begins in the uterus or in the pelvis. It begins here.
Girls have actually started 25-26 ki age mein to start freezing their eggs. How healthy is it? There are many myths and misconceptions when it comes to a woman's health. And we're going to clear some of them today. Very happy to have Dr. Surpreet Kaur Sandhu with me today. Ma'am, thank you so much for coming.
Thank you so much for inviting me. And thank you so much for giving me this beautiful platform, Devanshu. Thank you so much.
How long has it been since you've been practicing?
20 years.
So we can say 2 decades. Say
2 decades,
you've been
yes.
practicing. In terms of awareness, we can also add on like 20 years back when you had
Awareness,
actually...
yes, of course. Awareness in each and every aspect. It's because of the awareness, everybody knows about their options nowadays. So much so, Devanshu, now because we know what we are talking about, awareness is good only till it is giving you or it is advantage for yourself. When it is not giving any advantage and it is going towards the disadvantage side. Nowadays, there is a term which is specifically designed for the things which are going on in the society nowadays, and that is known as idiot syndrome.
Okay.
IDIOT. That is information derived from internet,
Right.
which is
Right.
inhibiting the treatment. IDIOT. So awareness is good, but only till the time when you know it is not hazardous for you.
And this is one of the biggest battle for doctors these days. Like they're telling, nahin, Google pe to humne ye padha, ye ho jata hai.
There are two aspects.
Have you ever encountered
It's always two aspects to the coin, Devanshu. It's very good. Very many times we don't have to explain as much as we had to do like 10 years back or 15 years back.
Correct.
Most of the time, the people, they are well read, those who are coming. It's only the thing when they read this and then they start become anxious. That is the time which it really inhibits their treatment. That's a time when they are not doing good to themselves. In the simplest language.
Okay.
It is very good to get some info, but that information should only be limited to information.
Correct.
And not inhibiting or starting your or deviating your treatment.
I'm very curious about, I'll just start with this term, PCOS and PCOD. Why has it become so common today? In my own circle, in my friend circle, colleague circle, girls are freely saying, oh no, I got PCOD, I have PCOS. So, पहले तो इसमें commonly बोल रहे हैं कि I'm like, okay, must be then. Until I read about it, and it was not that common 10 years back. So, what is it, if you could tell me? And is it that severe?
It started with PCOD. Then the term changed to PCOS.
Okay.
Then the term changed to PCO. And now it is PMOS.
Right.
So PCOD is polycystic ovarian disease. Then it came to polycystic ovarian syndrome. Then it was just polycystic ovaries. And now it is said that PMOS is polyendocrine metabolic ovarian syndrome.
Explain.
So so this is what the thing was from the beginning. It was endocrinal changes inside the body along with the metabolic changes inside the body. As the researchers progressed, first and the foremost was like 10 years back, it was said that any person, this was a misconception in the society that any person who is going to have PCOD, they are diagnosed with PCOD,
Right.
they have to take hormonal medications.
Acha.
So this was the biggest myth.
Okay.
And most of the girls, even when they were, you were saying that it was not
10 years back.
10 years back, it was not diagnosed.
Right.
It must have been there, but not
That
in this.
common.
Yes.
This term used everywhere.
Yes.
Right.
So the first and the foremost thing is because it was treated hormonally, and the second thing is the basic reason why this thing happens is just one thing. When it was converted, when the term was converted into PCOS, it was at that time it was explained that it is not a disease, it's a syndrome.
It's a syndrome. Right.
Syndrome means there are certain things which are there inside the body, which is creating this internal environment in a female's body that
Right.
she is getting her periods irregularly, she is gaining weight, she is having hair growth, and multiple symptoms which
Correct.
each and every person knows nowadays.
Okay.
The simple treatment for that was that you have to take care of your lifestyle, your
Eating
dietary
habits.
changes,
Eating habits.
and your basically you have to sleep well. There is this term in Hindi. If you go back, this is what according to us we have put it in researches and now it has come out. In our culture we have known this since
Years,
ages.
This
Khan
PCOS?
Pan,
PCOD you're talking about?
about the things which were to be changed.
Correct.
The treatment, I'm talking about the
Correct,
treatment part. Diagnosis to ho gaya.
Correct.
Now, Khan Pan, Rehan Sehen,
Correct.
Aram Vishram.
Correct.
Khan Pan is your dietary changes.
Dietary changes.
Rehan Sehen is your lifestyle modifications. Aram Vishram is mindful sleep. That's why now it has been changed to polyendocrine metabolic ovarian syndrome. So now it is self-explanatory. So the thing is, what you have to do, the treatment remains the same. First, you have to take care of everything. You have to take care of your dietary changes. You have to take care of your lifestyle. You have to have your mindful sleep and all. Only then, if something remains, that is to be treated by hormones. In all probabilities, if all of these three things they are taken care of, there is nothing remaining which is to be done. Only, that's why I'm saying, if along with the PMOS, if a person is trying to conceive or if she is having some other thing which is to be done, that's why and that's how we say that because of this, if something else is being hindered, then we give the treatment.
But
It's
why
not
has
a
it
disease.
become so common? That is my concern.
Because of the exact reason which is there in your hand as of now.
Is it the lifestyle
the
are we
reason.
talking about?
It's
Is it
the
just the lifestyle?
continuous-
Is it what, like, because lifestyle is the sole reason for it happening? Because if I'm saying today, if I go out, if I'm speaking to 10 girls, 6 girls are diagnosed with it.
Those 6 girls, just ask them about how much of the physical activity they are indulging in.
Right.
And how much of mindful sleep they are having and how much of a good food or nutritional diet they are having.
Correct.
And how many hours they are sitting at one place and they're doing their job with all sorts of emotional, physical
Right.
and mental instability.
If I ask you honestly,
Hanji.
sorry to cut you short, is it the way they say it very casually, I got PCOS, PCOD, as a man, I think मेरे को जिसको नॉलेज नहीं है इतने मेडिकल टर्म्स की, अब मुझे भी पता चल गया PCOS और PCOD होता है, इतना इंटरनेट पे देख लिया, पता चल गया. बट इज़ इट दैट लाइटली कि हम जिस तरह से बोला जाता है उसको लें, या इट कैन हैव इट्स ओन रेपरकर्शंस आगे चल के इफ़ नॉट टेकन केयर ऑफ? एंड आर females these days, girls, youngsters especially, are they taking it very lightly, or it can affect their mid-30s, 40s severely? That's what I want to know.
Any endocrine disorder, any metabolic disorder, if not taken care of, will give you repercussions. They will give you problems in the later part of your life. End of story. We are just
In what
tagging this as PCO or PMOS nowadays.
PMOS.
But the thing is, anything, a disorder. Devanshu, if this room is there, all these things they are there, if I jumble it up, so it's a disorder, yes?
Correct.
What do I have to do?
You have to rearrange
Order,
it,
yes.
reorder it.
We have to put it in order, and that's how it is taken care of. In the same way, when there is something inside your body, we are again and again saying that this is a disorder, it's not a disease. If a female, she is not feeling fine, she is not having proper sleep, she is not having her proper periods, she's not having her proper diet, needless to say, what all is going to ensue. First thing, second thing, because of this, now because we are talking about a female body,
Correct.
if she is in her 20s,
Hmm.
every decade the hormonal changes they occur. 10 to 20, everybody knows. The periods they are starting. 20 to 30, they have started, and the female, either she is preparing for pregnancy or she has already had a baby. 30 to 40, in the later parts of the 40, you go towards the perimenopause. 40 to 50, it's a menopause. Now, this is when everything is happening absolutely as it should happen, as
Right.
normally.
Right.
And
The
if it
cycle.
is not, if it is not,
Correct.
then it really creates problem. It will give you irregular bleeding, heavy bleeding, unpredictable bleeding. Where it will start, how can that end, nobody can predict
Nobody
that.
can predict.
Is the first thing. The female, the most common thing is the female, she is sitting in the office and then she is like totally drenched. She runs off to the hospital. She gets her injectable done. She comes back home, and the second day onwards, the same thing repeats again.
Oh God.
So this
When I
is
think
one of
about
the
it,
things.
something is happening.
And the second
My
thing
God.
is definitely you will have problems while conceiving. So if
It makes your life more tough. I mean,
yes, it
we
does.
just know about period cramps. This is another thing which is adding up.
Yes,
My God.
it does. And then again, this is only the thing we are talking about, periods, normal cycle.
Right.
And the same couples, when they come and for unending, that unending torture or embarrassment which they feel when they are trying to conceive and they are not able to conceive.
Does it cause us
That's
problem in conceiving also?
Of course, it does.
100%?
80 to 90%. It does.
How long does it take for someone to get rid of it? Timeline में अगर आप मुझे बताओ तो.
Depends upon how
Severely
good she is with the changes which are to be made. If she is doing it religiously, within 3 to 6 months, she herself, she'll tell you that
She'll
these are
get
the
rid of
changes.
it?
She will be quite better.
Okay.
She'll be much, much, much better.
I have one more thing. I mean, there's another term. You can correct me if I'm pronouncing it wrong. Endometriosis.
You've pronounced it absolutely wonderfully well.
Right. I recently, like earlier, I didn't know about this. So I follow a Hollywood actress, and she and her husband, they started promoting this, and they started talking about it. That what is it? I did my research and I found out. But I want to know from you, what is it, and how, like, is it really difficult to, like, once, to diagnose it? Like, if we talk about its repercussions, because the knowledge amongst youth, अभी मुझे ही नहीं था. तो मैंने जब देखा until unless अब Hollywood star promotes it and starts talking about it, I'm like, okay, now it's a big thing. Now we need to understand what is it, what are the reasons behind it. So if you could just, shower your knowledge on this a little bit.
Devanshu, thank you for asking me this question because, it takes a Hollywood actor or actress to say something like this, with which near about 40 to 60% of the females nowadays, they are undergoing this thing and they are bearing the side effects, the very grave side effects of this condition.
What is it?
Endometriosis is the endometrial tissue not being inside the uterus, but somewhere else outside the uterus. So what happens is mostly it is outside the uterus. It's in the POD. POD is it's the space around the uterus. I won't go into the much of the
deeper,
technicalities.
Right.
Around the ovaries, around the tubes. What happens is it becomes very, very, very painful. Normal period pains and the cramps is different, but once a female, she's having endometriosis as an add-on. It gives severe pain. Now, endometriosis is again there are 4 stages of it, from 1 to 4 according to the severity.
Correct. Whoa.
It is just the presence, and till the stage 4 being everything caked up inside the pelvic cavity. Everything is adhered with the adhesions because of this sticky spots inside. This is what the endometriosis is.
How is it different from the period pain?
It is
Is it like
because
worse, 10 times worse than that, or what is it?
Devanshu, the thing is now the quantization of this thing is very difficult because this pain, the period pains are spasmodic pains. Yes, it comes and it goes.
Ji. Correct.
This pain will remain throughout as a dull pain.
Oh God.
Very very irritating dull pain the
Correct.
whole throughout, and when the period comes, it exaggerates by leaps and bounds.
Adding fuel to it.
Of course, according to the stages, stage 1, stage 2, stage 3, stage 4. So this is how it exaggerates. But the thing is, it is far, far, far worse than a normal period pain because it really does not respond to any antispasmodics which you take. Period pains, they will go with the antispasmodic medications. The pain of the endometriosis, and this is how one of the diagnostic point that how you diagnose that the patient is not having just the plain period pains but the endometriotic pain is it seldom or it rarely responds or responds less to the antispasmodics.
Is it like a very severe condition, and the fact
Severe
that you're saying 50
condition-
to 60% people are already, you're witnessing such cases?
It is giving rise to infertility,
Oh my God.
and this is how we are coming to
My next question was about
it's
that, to be
infertility.
honest.
Yes, it is giving rise to infertility.
Yeah. So is this the starting stage of infertility? Because my next question was, why has the fertility rate suddenly dropped in India? What is the reason behind it?
Devanshu, on that I can talk about 24 hours.
Nahi,
So
thoda to
like
bolo.
the thing is the PCO and the lifestyle. The first though physical, mental and emotional things they are to be taken care of. If they are not in line,
Correct.
you will have problem. Infertility never begins in the uterus or in the pelvis. It begins here.
There's a lot of lifestyle stress and whatever you're doing in
This is
day-to-day
what it is.
activity.
These are add-ons. Endometriosis is an add-on. Multiple surgeries is an add-on. Previous infection is an add-on. And why all this thing is happening? Because of the low immunity. I'm talking about the infections, not about the endometriosis. I wish I had an answer for endometriosis. Why is this happening? It is, there is no explanation, there is no answer to it. As there is no answer to why the fibroids
No
happen.
scientific explanation towards
No, it happens. As the fibroids happen, the polyps happen, endometriosis happen. किसी में कम है, किसी में ज़्यादा है, but there is, because of that, if you have had an explanation, there will be a medicine, yes? So we can just suppress endometriosis. The treatment is surgical. If we had a medicine, we will give it to the patient and she will be getting rid of it. It is hormone dependent till the time it is being fed by the same hormone which is giving you fertility. These are the hormones which gives you a patient who is undergoing menstrual cycle. The same hormones, they feed endometriosis also. So till the
Correct.
time she is having her menstrual cycles, she will have this thing. Most of the time in the postmenopausal females, if she has had endometriosis in the later part, 40 to 45 years of age, it can very well be taken care of by some painkillers. And after that, once her menstrual cycle goes absent, this thing is taken care of. Because the feeding hormones, they are no more there in the body.
Correct.
So till the time this thing is happening, so first, there is no explanation why it happens. And second, there is no medicine to treat it. It is the medicines which are there, they are just to suppress it.
As of right now, there is no treatment particular to it.
If you want to treat it, then the patient, she won't be able to conceive.
Oh.
Because the same hormones which are feeding the endometriosis are needed for the pregnancy
My
itself.
God.
So
मुझे तो पता ही नहीं था. I mean,
byways.
I didn't know this.
So the best thing is if a person has to undergo fertility treatment and she is having endometriosis, the best thing is surgical. You go for the surgery.
I have one very interesting question.
All the questions till now
All
were
the
very
ones are very
interesting.
interesting, but this is like, as a coach, I speak to a lot of 95% of my clients are females, right? And they all are working. Someone is having their own business, someone is a working wife, doing their corporate job, everything. I read a study recently that 80 to 75 to 80% of the women these days who are in their late 20s, in their early 30s, they're purposely delaying their marriage because of their career. And there's something which made me very happy कि अच्छी बात है. There was a time when there was actually a fight battle for career की female का नहीं होगा. It's a pride वाला thing. But at the same time, I had this thing. I had a doubt because I spoke to a lot of females and they were like, sir, lekin I do have this concern that I'm 32 now. And I went to my gynac and she said, fertility rate तुम्हारा drop हो गया है, थोड़ा कम हुआ है. So my question to as a guy to ask you is, does a age factor play a very important role in your fertility rate, in dropping the fertility rate? And is there any right age for females to conceive? And I want you to be very brutally honest.
Oh, Devanshu, I'm known for not saying any sugar-coated words. So don't worry about
Yeah.
that. The thing is, Devanshu, if we are talking about the age 30 till 30, it's a green zone. 30 to 35, you should really start working on it. And after 35, your fertility, it really does goes on the opposite
of
way. Yes,
extension.
you yourself, you said that the females, they're delaying their marriage
Purposely, yeah.
for having their career set,
Correct.
which is like absolutely good. They
Top
should be
notch.
feeling 110% confident
Top notch, yeah.
that they are perfectly fine with themselves. They know their body well and they are perfectly
Correct.
confident
Correct.
that if the baby comes, they are able to take care of it.
Mm-hmm.
Just for the sake of it, you're getting married, it's a big no-no.
Big no.
So what do you do about it? Kindly go and get your eggs freezed. Eggs, frozen eggs, they go a very, very, very long way. In the Western countries, it has been happening for quite a long time. Nowadays, we have started and it is as earlier the better.
I think India में 5 साल पहले इसकी एक वेव आई थी. Speaking about, because ये था कि, like I mentioned, career focus was one of the things. Marriage delay was another. Could be endless reason क्यों delay हो रही है. But at the same time, girls had this awareness now, जो कि पहले नहीं था. अब पिछले 5 साल से थोड़ा बढ़ गया. Because one of the Indian actresses, she also promoted how she, froze her eggs long back. And she's now based in, Hollywood, US. And she has a healthy baby. तो तब से थोड़ा wave आ गया. And girls have actually started 25, 26 के age में to start freezing their eggs. How healthy is it? And is it
That's
safe?
the best security. Just 3 months back, I delivered a patient. She is 47 years old.
Okay.
And this was her first pregnancy.
Oh.
No questions asked. She wanted to get ahead in her career. She wanted to do good. She wanted to be settled. She did. She froze her egg.
When?
When she was 38. It was
That
late
is still
for her.
late.
She was late for that. But not that late.
Oh.
Not that late. She wanted to have her pregnancy at 47. She started thinking about it at 46. She finally got her baby at 47.
My God.
But this is the beauty of it. Devanshu, this is what
47 की age में
first baby. So why should any female cannot opt? I'm not saying that is how everybody should go. I'm telling about the other end of the spectrum, that this is also happening nowadays. It is as early as better.
So let's just say for a
20,
female who's
25 years,
25,
28 years, you can get your,
between the
yes.
age of 25 to
Yes, yes,
28 years,
yes,
let's
yes.
just put it around
Yes,
that.
yes, yes.
That's the best time to
that's the
freeze
best
your
time.
eggs.
That's the best time.
Perfect.
Any age before 30.
At the same time, we have spoken about pregnancy. Like everyone knows, the challenges are happiness, but at the same time, a lot of challenges when a female is pregnant. But what I really want to talk about is post pregnancy. I think a lot of humans, a lot of us, we miss out on the challenges faced by a female आफ्टर द प्रेगनेंसी postpartum depression करके भी एक टर्म होता है जो कि कई लोगों को पता ही नहीं है. Made a video on this, but at the same time, I think for awareness, I would like to ask you what are the challenges faced by a female after the pregnancy, like post pregnancy? What is postpartum depression? And if there's any case you witnessed in this 2 decades of your service, if you could talk about that.
Vanshu, this is such a beautiful question. The thing is, the moment the baby comes, the whole of the
Now the kid is there. Everything.
the kid is there.
Focus on the kid.
It's streamlined focus on the kid. It shifts from the mother.
Yeah, correct.
Most of the households nowadays, because everybody is so well read, this is where I say that we are blessed in this era that you are having very many things on Google. The female herself, she can Google, okay, I'm having these things, what is the problem? And she can speak it aloud.
Correct.
Nowadays, they are blessed with the good family members and the understanding family members. So that is good if that thing is being taken care of. What things are being missed is, ye to hota hai, ye to chalta hai. So this is not, if something
and this has been carried since generations. Pehle se hi.
It is. Because whatever said and done, there are certain myths which in each and every country, they sort of normalize it after the female gives birth. There are certain mood changes, there will be some lifestyle changes, there will be some sleep disturbances and all. But when it really starts affecting an individual, it can be both ways. It can be on both parents, but because mother is more available for the baby and because the baby is there, she has to breastfeed and all. Her work is, of course, it is much more than a father. So that's why she is more with the baby, and that's one of the major reasons her symptoms, they are left out. Her symptoms are not taken or either whatever she says is taken for granted. Yes, you were up the whole night around, you will feel weak, you will feel irritated, you will feel exhausted. This is normal. When these things, they are getting repeated again and again, and when this thing starts affecting female mentally,
correct,
and when there is a definite change, basically what I tell all my patients is that you don't have to wait for some change to occur. You're having some problem which you know your body very well. If you have become a mother at 30 years of age, for 30 years you have known your body. If something is not right, you kindly come and discuss that with a professional.
Does it get more difficult for a female post-pregnancy? Pregnancy, everyone knows that she has a baby inside. It will be uncomfortable, it will be a lot of weight added to her body. But talking about postpartum depression, people have now started to gain some wisdom regarding this. Ki ye bhi hota hai. There is a depression after, a female.
It's very common, Devanshu.
Right now, but
very, very
people
common.
have started to acknowledge this. Ki
Yes.
ye common hai and isko address karna bhi zaruri hai. It's very important. So, what are your take on that? Because ये चीज़ जाननी बहुत ज़रूरी है. What are the challenges post the pregnancy and how one can cope up with it?
So Devanshu, there was this case, the post-pregnancy thing, and one is PPD, the postpartum depression, but there are very many times when the females, they are not able to tell out the problems which they are having in the intimate parts. So one of my patient, she had her delivery done in suburbs, and might be possible they were not very okay with it, or the person there, they didn't stitch her up. The cut was given, but the stitching was not done. And she bore that for whole 7 years. Yes, and then she came to my clinic just two and a half weeks back.
7
And she, yes, 7 years,
God.
she was had it healed up in its own ways, but then the cavity was like totally open. The opening was like too much open, so much so that it was giving problems in her married life, which I think you can understand.
Of course.
I had to take that. That's where my cosmetic thing comes. So I had to take that patient, and then I had to rebuild the whole thing. And now she is good. And the best compliment by God's grace, which I got from that female was, she says, as if I am reborn, this is what this surgery
My
is to
God.
me. Even when I was walking, when nobody used to see me, or nobody used to know what I'm undergoing or what problem I'm having, I had zero confidence. The way she walked into my clinic after the surgery, there is this follow-ups which you do. So after 1 week, after 2 weeks, the third week when she came, this is the thing which she told me, that this is like a rebirth to me. And I was so blessed. I really wanted to share this thing, that it is not necessary, that it is the absolutely postpartum or the post-pregnancy which we are talking about, the things they can linger on for years and which you don't know
My God.
about. So that's why I said that the females, they themselves, they have to talk about it. They have to come out of their zone, the comfort zone or whatever zone. So this is how it happens, and this is how it can be taken care of.
My God.
The moment something like this happens, it is not only the female who has to take care of it. The family members, if they think that she is unnecessary or unnecessary crying, or not responding to what you are saying, she is being absent in the conversation, she is not having her, whenever she is getting time to sleep, she is not able
Sudden
to
anger
sleep.
issues.
Mood changes.
Mood changes.
Mood
we would say.
changes.
Yeah.
Now there is a very fine line when this is normal and when this is going towards abnormal. So that is the exact time when the family members, they have to get hold, and then they have to talk to the professional or the gynecologist who's taking care of her. So in the very initial stages, if it is taken care of, which nowadays I'm very happy about that, that most of the people, they do come. The females, because if they have taken the classes already, they know, and they will tell, this is not fine, this is not me, please get some help. If she is not able to do it, then the family members will. So there are different steps. If not her, the husband. If not the husband, the family members who are there. If not the family members, the nanny who is around. So there are definite. You always delegate. That it's not one person's. You say, when we say that it takes a village to bring up a child, so there is a very deep sense when you're saying this. It's just not the child. It's the mother also who's being taken care of. So it's the elders
Correct.
around or the help around who will tell you that this is normal. If she is able to tell, it's very well and good. Not if it's not her, then the people, those who are around, they will tell you. And the moment you feel something like that is happening, absolutely, you have to take care, and the professional has to be involved.
Any case, like any incident that you very vividly remember that happened after post-pregnancy and it was a disaster, but somehow the life got saved? Anything that can help the viewers also to understand the severity?
Devanshu, it's a tragic comedy, I believe so. One of my colleagues, she herself being a gynecologist, there are very many things which are taken for granted.
Correct.
That she is there, she'll be taking care, and then if something is wrong, she'll tell. She was blessed with a very good family, with very good help around. She went into PPD. So, and that PPD was, it had to be taken care of. What happens is, in such conditions, we have to separate the baby from the mother.
Oh.
Yeah. Because the baby's cry or something, anything which triggers, that will be triggering her. There are different stages of PPD, postpartum depression. So she was in a moderately severe stage, because it was only in the later stages when everybody did understand that something is wrong, because everybody was taken. It was taken for granted that if something is going to happen, she'll tell. But this happened to a medical professional, that also a gynecologist, and then the baby had to be separated for whole 2 months. And then everything, then she underwent therapy and all. So it was a very, very, very long time when we got her back. By God's grace, everything is fine now. But that was one thing which was very alarming, and it was very scary. When you were talking to her, this is what I'm telling you. If she's there with you, in the very next moment she is not in the conversation, and then she will start crying, and then she'll start getting angry. She'll start throwing things around and all. So this is how it happened. So there are certain, and this is only a psychologist or a psychiatrist who will take care of this, and they will be diagnosing, and they will be telling you that what are the precipitating things or what are the triggering things. So those triggers, they are to be absolutely separated from the patient, and that's how you get the patient back.
Quite deep though, but I mean, the more you have cited it very बहुत easy way में you have made me understood about this, but I'm sure deep down it's very complicated to even go through
Only
such
if it is
thing.
not taken care of.
Correct. And
That's
I
what I'm saying,
think don't, for anyone who's watching this, don't take post-pregnancy very lightly. It can actually be very threatening for a female's
very, very
health.
threatening. It can
Right?
be.
I mean,
As-
pregnancy is not the only time where you need to be very careful just because the baby is inside. I think even when the baby is outside, the thing that you really need to take care of is both your kid and the wife simultaneously, right? Because, I mean, this is what I really believe, but thank you for clearing things out and making me like, okay, तुम ठीक सोच रहे हो, वैसे ही सोचो. One more very interesting question I have, and I'm sure very like the young female audience, they'll be very interested to know about it. The unwanted pregnancies amongst single females, single women.
Devanshu, not in a very, I think so. I just said that the natural pregnancies or the accidental pregnancies, this is how one of the sentences or one of the types of these pregnancies, how we can put it forward, is accidental pregnancies. Now, accidental pregnancies, they can happen at any age, at any point of time.
Correct.
The first and the foremost thing is the female should be totally safe and secure. Unwanted, accidental, a pregnancy is a pregnancy. If you want to continue it, it's a totally different thing. If you don't want to continue it, that's a totally different thing. If you have to continue, you know very well, everybody, this is protocolized nowadays, that you have to go to a gynecologist and then you further start your treatment. If it is not to be continued, that is where the real war begins. Just right from the over-the-counter medications which you get, how it is being diagnosed, whether it is being diagnosed correctly or it is the incorrect diagnosis. The diagnosing kits which are available, they are not 100%.
I just saw it. Sorry to interrupt. I just saw it yesterday only that one of the contraceptive pill, it is termed as it's cancerous. It's मतलब कैंसर हो रहा है उसको लेने के बाद काफ़ी लोगों, एंड काफ़ी लोग उसको सालों से ले रहे हैं. That's a unwanted contraceptive pill. I mean, my God, people like, let's just say anyone who's afraid of visiting a gynac during that time and she takes that pill, she is inviting a lot many other problems.
That's in a distant future.
Oh my God.
Devanshu, what we are talking as of now is first getting the pregnancy diagnosed, whether it is intrauterine or it is extrauterine. If it is extrauterine, any female of any age, if she goes and she takes over-the-counter pills, and I'm not talking about morning after pill. Morning after pill is to be taken when there was an unprotected sexual intercourse. This is when you have conceived. So we are talking about at this point, without being diagnosed, whether the pregnancy is inside the uterus or outside the uterus. Everybody knows there is a 5-tablet strip. You go there, you tell the pharmacist, they will be handing it to you. They will tell you how to take it, and you take it, and you are getting rid of the pregnancy. Yes, many a times it works. but many a times it gives you drastic and grave responses, so much so that they are life threatening. Because if the pregnancy is not inside the uterus and it is outside the uterus, it can rupture. If it ruptures, it will be rupturing inside your abdomen. How much would you bleed? Till when you will bleed? And how much your body will take? Or when you are standing or you fall without any signs and symptoms, you're there on the ground and nobody is able to make out whether you're there at home, you're there
What
at
is
your
the reason
office.
behind it?
No.
Complete blackout.
Yes.
My God.
And then when you are rushed to the hospital, by that time, if by God's grace, if you're blessed enough, if your diagnosis is made, and if you're taken to the OT, your abdomen will be opened up, whole of the blood will be cleared. Let me not go into those
The
technicalities. That
right.
has to be taken care of by surgical methods.
But it's
And
not
then
advisable.
it is not at all. It is not to be done. Always, if you. That's why I said the starting of my discussion was that whether the wanted or the unwanted pregnancy, whether you want to go ahead with it or whether you don't want to go ahead with it, the final thing where it is to be taken care of is a professional. Kindly come to a gynecologist. Kindly get yourself diagnosed first. And then accordingly, if you don't want to go ahead, there are different methods for the different people according to the different stages. If a person is already having a cesarean, one cesarean, two cesareans first, usually the medicines, they don't work. If the person doesn't want to go ahead and if this was the first pregnancy, and the person is not very aged, they are towards the younger side, we give the medicines. For each and everything, first and foremost is kindly come to the gynecologist. Now this big myth that when you are having morning after pills, you are totally secure with that. No, you're not. You're not at all secure.
That's the message you want to convey to anyone who's just dependent on that pill. Now they've taken the pill, now they're fine. Doesn't work like that.
Not at all. It is laden with hormones. It is laden with lots and lots and lots of hormones.
And you don't know how your hormones are reacting until you meet a gynaec.
No. And this can very well, cancer is one of the things, but before that there are 100 more things which can give you so much of problem which you can't even think of.
That can also affect the, fertility and...
of course.
Okay.
Of
that
course.
threatens your pregnancy
in
also
a royal
in the
way.
coming
In a royal way.
Oh.
Yes, which you can't even think of because these hormones.
This is scary.
Yes,
For
it
a lot
is
of
scary.
females.
It is scary.
Yeah.
It is if you take a packet, it is written.
Yeah.
The warning is written that it is emergency contraceptive pill. Now, emergency, God forbid it happens only once or twice in your life. Emergency is emergency. It's not a normal contraceptive pill. So every time something is like that is happening, it will give you very grave effects. Kindly do not go with that. The chances of getting ectopic pregnancies, that is the pregnancy which is outside the uterus, they are much, much, much more with the people, those who are taking emergency contraceptive pills on daily basis.
My God.
Or on a very regular basis. The chances of them having lots and lots of problem while conception is much more than the people, those who are on the normal contraceptive pills. So it is not to be taken. Now the thing comes that if not that, and if you don't want to be dependent upon your partner, I'm talking about the females of course, if you don't want to be dependent upon your partner, what else can you do?
Yeah.
You don't want to have pills, you don't want to get those 21 days pill because it's, of course, it's that extra work you have to put every night. You have to, by ledger you have to, yes, you have taken it or not. It's an extra work. What do you do?
Yeah.
So for those people or the females, female condoms are available. They are very much available. Kindly go ahead, use that.
There's very less knowledge about it.
It's and it is very easily available, Devanshu. It's very, very easily available. It's only the thing is that when you start using it, it has to be used for everybody to understand that how easy it is. You don't have to pop anything. You're not popping any pill.
Correct.
You don't have to have something on your ledger that this is how you have to do every day.
I think Europe has the highest say, मतलब अगर इसके बारे में पढ़ा जाए awareness यहाँ पे सबसे ज़्यादा यूरोप एंड किसी बाहर की कंट्री में अगर आई माई सेल्फ लिव्ड इन लंदन फॉर 3 years, अवेयरनेस इज़ वेरी मच देयर. इसको मैं कहूँगा. अब वो कैसे भी हो, या तो पॉपुलेशन काउंट कम है या इजी मेथड है बाय काउंसिल के थ्रू आ जाता है, But the thing that you mentioned about when it comes to female protection, and yep,
yes, female condoms.
it is very much there. But I don't see that happening यहाँ पे इतना इंडिया में, because once you mentioned about when it comes to protection for females, there's very less. The only thing which they know is contraceptive pills. At least what we have heard about. Might miss out on something.
No, not at all.
Yeah.
Devanshu, pata apne, when we are talking about India, we are blessed with the easiest internet.
Easiest internet, right?
If you want to go ahead with any of the topics, when you have to read, everybody can be very well aware of. The only thing is, that's why I'm saying that thank you for inviting me on this platform and thank you for putting this question out.
Yeah.
This is how, when these things they are discussed, this is how the awareness will happen.
Will happen.
There is nothing which is deficient. You have internet, and it is very easy internet. I won't say costly, I won't say not very costly, I'll say easy internet.
Easy internet.
So you having that thing, and if somebody is scrolling, they can very well scroll on this also.
Pretty much.
When we are talking about female independence, according to me, this is where it should really start. You should be totally independent. You shouldn't be dependent upon your partner. Why?
I think this is very enlightening for most of the young audiences, I would say, who will be watching this.
Why,
Because, yes.
Why for your own safety you have to depend on somebody else?
Correct. Absolutely.
For your own safety you are depending on somebody else. You said that unwanted pregnancy or accidental pregnancy. Devanshu, how many times have you seen or have you heard of, because you said that 95-96% of your audience or the podcast with whom you have done, they are like females. How many of them have told you that whenever certain things like this has happened, a partner accompanied the female to a gynecologist clinic? Seldom.
I think you must have seen such cases.
Seldom.
throughout your life.
So the thing is, why to depend for your own safety? You're depending on somebody else.
In the end, it's your own body.
Yes,
You are more
you have
answerable
take
to it
care
as
of it.
compared to
So
anyone.
why not? And when you're having the things available, so female barrier contraceptives, they
I
are
think
there.
थोड़ी life advice भी आ गई है आपके through. I think which brings me to the last question. It's about menopause, right? I think, as per my knowledge, जितनी पढ़ाई करी है, it comes around the age of 43 to 45 years.
Exactly.
That's the rough idea about the age. People have knowledge about menopause, but they take it very lightly because उनको लगता है because उस एज पे तब तक फीमेल इज़ इन हर मिड एज, आराम से 43-45 में आ गई हैं, उनको इतनी ट्रबल नहीं होनी चाहिए नाउ दैट शी हैज़ किड्स एंड किड्स आर ऑल्सो ग्रोन अप. तो पीपल डोंट हैव दिस अंडरस्टैंडिंग दैट मेनोपॉज होता तो है, लेकिन उसके इफेक्ट्स एक फीमेल को कितना ट्रबल कर सकते हैं. इज इट नाउ माई क्वेश्चन टू यू इज, does menopause, how does it affect a female at that age, and is it something we shouldn't take lightly, and if yes, what should be taken care of?
Devanshu, it's such a huge topic. I'll be explicit. I'll
Yeah,
be
just
short
cut
and
short.
explicit. Yes. So the thing is, it will in more ways than you can think of. It hampers the female's body. This is the first thing, and the second thing is, because what I'm talking about is any female, whether she is going out for her work or she is not. Any female, when this age comes, considering the normal population, those who have had their kids at the age of around about 28 or 30 years of age, this is the time when the kids, they grow and they are teenagers. They are very demanding.
Correct.
This is the time when they are trying to settle down in their careers. That means at their office front or the work front, they have to be present there the whole time around. And this is the exact time when her hormonal cycle is taking a toss.
Correct.
It is haywire.
Right.
All the hormones, they are going haywire.
Haywire.
There are 50 hormones, just a figure of speech, and hormones, they are like orchestra. Even a single instrument goes here or there, the whole orchestra fails. So this is how even a single hormone goes here there, the whole of the internal environment of the body of a female, it in the real sense it fails. So what we are talking about is female in her personal space, she is not she can't understand what is happening inside her body, personal space. At her home front, the teenage kids, they are growing and they themselves, they are very demanding. At the office front, this is when she is getting to a position and she has to either hold onto it or she has to toil upwards towards it. So this is very difficult time.
My God.
And that's why I started
And
with
she's left
involvement.
alone during that time.
Yes,
and,
most of the time. Because everybody, they are very, very, very comfortable in their
And
own
they're like,
space.
why is the mother suddenly so grumpy?
Yes, very
why,
grumpy.
Why is she getting angry on small things?
Yes, yes.
And then
yes.
they're like, oh, is it the age? No, it's not the age, it's the menopause.
So
Which you barely have any idea about.
the bottom of the story, who has to take care of it? It's the female herself. By this time, she has a voice. She has to speak it aloud that this is
Correct.
my problem
Correct.
and this is how it is to be taken care of. And again, at that time also, your life is on a tripod. That's physical, mental, and emotional well-being. So these three things, they have to be taken care of. And definitely, if we go into the treatment part, only and only if needed, then the hormonal therapy is to be initiated. Otherwise, not. It is very well taken care of by the normal lifestyle or dietary changes. That's about it.
Perfect. Right. So before we sum up, I have a quick rapid fire round. So you don't have to just have to answer in one word or 2 words maximum. And I'll just start with it. Ready?
Yes.
One habit every woman should start today for better reproductive health.
Exercise.
One health checkup women should never skip.
Whole body check and pap smear.
Okay. Worst pregnancy advice you have ever heard? This is
So many.
one.
Don't move when you're pregnant.
Oh God. One symptom women should never ignore.
Anything which is there with your sleep, never. Don't take it for granted.
Okay.
Sleep.
One piece of advice for husbands whose wives are pregnant.
Take care of yourself.
Why?
If you are mentally sound,
Yeah.
then you'll be able to take care of your
Correct.
partner. So it's that you just kindly take care of yourself.
All right. One question you wish every woman should ask her gynecologist. Tick, tick, tick.
Anything. You want to ask anything, you want, just ask anything. It depends from patient to patient. Just ask anything.
Okay.
Whatever is bothering
Let's just say it's
you.
a very, a girl in her early 20s.
How can I go along and when should I plan my pregnancy and how do I go along with my intimate hygiene? That's one.
That's it. Perfect. What's the funniest myth a patient has believed and you have come across it?
A patient came to me and then she said that there is something wrong with her YouTube.
YouTube.
That was fallopian tube.
Well, it could
You
be
said
YouTube
funny.
though.
You said, yes, it hurts tube, yes. Tube.
Oh God. What's the biggest lie women have been told about their bodies?
You remain perfectly fine for the whole of your life and your body doesn't change.
If every woman watching this podcast remembers just one message from you today.
Take care of yourself and speak for yourself. You are the captain of your own ship.
Do not take your body for granted.
No, never. Never take your body for granted.
Perfect. Thank you so much. I think we had a lot of knowledge today. I mean, not only females, as a man, I can say anyone who watches this podcast, tons of knowledge. Thank you so much. As a boyfriend, as a husband, as a father, I think not only females, it's their responsibility to take care of them. It's equal responsibility for us also. And thank you so much, ma'am, once again for being here and shedding all those brilliant facts and misconceptions about female body and, you know, whatever we have been believing since years, and you shedding all the light towards it. Thank you so much.
Thank you. Thank you. I can just say thank you. Thank you so much for making me be here and answering all the questions.
Yeah.
I think so. I did have in my
Capacity.
capacity, I did answer. But the
You
thing
did
is
the
there
best.
was thank you so much. Thank you.
Thank you so much.
Thank you for having me here.
Thank
And
you so much.
And you were very supportive, Devanshu.
Thank you so
Thank
much.
you so
ma'am.
much.
Thank you.